My name is Dr. Joshua Dunsky from Dunsky Rehab and Spine Center here in Framingham, Massachusetts. And today I want to tell you about a patient, we're going to call her Linda. Linda just started with us this week actually for treatment of peripheral neuropathy. She has pretty severe spinal degeneration, spinal arthritis, severe disc injuries, and the end result of that many times is nerve injuries, neuropathy. So the nerve starts to fail, it starts to die. These nerves are peripheral. And so this patient, Linda, she started this week. She had her very first Hakamed treatment with laser. We're starting decompression with her next week. And she's been suffering with insomnia for years. She is exhausted all the time. She has chronic pain. She has an inability to walk properly because of balance. She came in this morning and immediately told Natalie, who's one of our staff here, that she doesn't remember when she slept so well. She actually had a full 4 hours of sleep. And some of you might be thinking, well, 4 hours, that's not a lot. Well, for someone who's been up straight for 36 plus hours, that's huge. She might get a few hours of sleep, broken sleep every night. I'm talking 1 to 2 hours, and then wakes up and is up for a while. Then she'll fall asleep for 45 minutes or an hour and a half. So 4 hours of good sleep is huge. She also reported that her feet are feeling better. We're talking one treatment. Now, I'm not here to tell you this is going to happen for everybody, but for a lot of people, they notice a change immediately, for a lot of people, from the Hakamed, from the laser, and certainly from the decompression that we do. So peripheral neuropathy is multifactorial. There are many reasons why someone has nerves that stop functioning properly. Compression on nerves for a while. I used to teach pathology and physiology, and if you look in any physiology book, it's going to say the same thing. Prolonged pressure on a nerve kills the nerves. So spinal degeneration can kill the nerves from pressure. Certainly diabetic polyneuropathy from either too much glucose or not enough. Someone who's insulin resistant. The cell starts to become damaged on the inside, the nerve cell. The blood vessels become damaged, so then there's less blood supply, less oxygen to the nerves. These are all causes. But the fact is, people often respond very quickly or have symptomatic changes very quickly. And for some people who've had, a situation been going on for years and years, it may take a little longer. But what we see more often than not are symptomatic changes very quickly in the clinic. So I encourage you, if you've been suffering or a loved one has been suffering with neuropathy, spinal degeneration, get checked. Go to some place local who specializes in that, whether it's here or somewhere else. Go to some place that you trust, get looked at, because peripheral neuropathy is treatable and you can get better.